Good morning, Yvonne.
Good morning.
Good morning.
Good morning. Do I have Tracy and Dr. Stillman with me?
Yes, you do.
Yes.
All right. Well, hi, my name is Yvonne McCarthy. I am also known as Bariatric Girl, and I am a blogger, and I am also a 10-year veteran of the R&Y open gastric bypass procedure. So, I wanted to start out with, I'm kind of amazed with the findings. Are you both? Well, let me go to Dr. Stillman. Dr. Stillman?
First of all, congratulations on your success. And unfortunately, I'm not surprised. You know, as an internist and healthcare provider, I know that for a variety of reasons, time and the lack of armamentarium or toolbox that the primary care has, that they're not talking to their patients about obesity, despite the epidemic or 97 million individuals that suffer from obesity or patients being overweight. So I think that's a big issue. I think the other thing is that the message of the efficacy, the long-term success and safety of bariatric surgery really has not gotten out to the general practitioners, not only with regards to their weight loss, but the profound medical benefits of, you know, resolving diabetes and obstructive sleep apnea and blood pressure and cholesterol and the like. So
that's what I wanted to ask you. Was it? Do you think? Was it more the fact that the doctors were not quite aware, or were they still sort of afraid of the procedure, and or was there also the stigma of, well, how do I bring it up to my patient that I have to tell them that they're obese?
Yeah, I think all of those. If you look at the survey, 6 in 10 physicians did not want to talk to their patients because they thought they were embarrassed to talk about it. But in fact, it was just the opposite. Patients want to talk about their weight. They're looking for an answer. The other thing is I think is a big problem is as primary care physicians think is weight loss surgery as being very, very risky and just about their weight. And they haven't got the message that it's very safe, it's very effective, and it's long-term. And weight loss is actually secondary to the profound medical benefits of resolving all the comorbid medical problems.
Absolutely. And Tracy, I want to say congratulations to you.
Thank you.
I know that you waited for over 12 years. I cannot imagine that. I just can't imagine that, because my story is very strange. Because it was 10 years ago, I made my decision in literally 15 minutes. I heard about it on TV. I made an appointment for the very first moment. Tracy, when you went to the surgeon, did your surgeon, did they talk to you about it? Was it brought up to you, or did you bring this up to the surgeon?
I actually was doing some research myself because I felt like my primary care physician, you know, he'd tell me diet, exercise, everything will be fine. So I did the research myself, and I went to a seminar. My very best friend had a sleeve gastrectomy the previous year, and I saw her success, and it was amazing. So it was a situation where I had to address the issue. And I mean, it was awkward for me to tell my doctor, hey, I want to have surgery. So I can't imagine how they would feel having to say, hey, I think you're a little too overweight and you should try this or this. But I really wish that he would have sat with me and talked to me a long time ago, because if I knew then what I knew now, I would have had the surgery years ago.
Yes, indeed. Well, I wish that had been my case too, but unfortunately, because mine was 10 years ago, I didn't have the option. And I would imagine you've got to feel a little special being the one that was picked to, for Ethicon endosurgery and the OAC to do the real life documentary series on you. That's pretty way cool. And so I think that also helps you as far as being accountable. And I did also want to ask Dr. Stillman, does he still find that you have a lot of patients that self-refer? Because when I had my surgery, when I first approached my PCP, I said, what do you think about, weight loss surgery? It was absolutely no way, no. And, that just wasn't that wasn't going to be the answer for me, and so I did self-refer.
Yeah.
Does that happen?
That is a great point, because there's so much trust and long-term longevity with the patient and their primary care doctor.
Yes.
So you're actually a minority who would go around him or her to self-refer. But to your point, we always send communications to that primary care doctor, because we believe, and the survey showed, is that once primary care physicians refer and have a good outcome, which 90-some+% do, then they drink the Kool-Aid, if you will, and
exactly.
continue the referral pattern. So we're very open about that. And a lot of insurances require a referral from their primary care doctor. So I think it's a win-win to have an open communication with the primary care doctor, because you don't want it to backfire. You don't want that patient to go back to your primary care doctor after the fact
Right.
and say, hey, I think I need some vitamins, or I think I need this. That doesn't work either. So I think trying to involve them from the get-go is the most beneficial route for all parties.
And also, as a bariatric surgeon, I did not really know this for quite a few years, that you guys were kind of treated kind of like I don't know what's the best terminology to use, but kind of the lower class doctors that would perform the surgery, correct?
Well, let me tell you, there's one lower. I'm an internist. I'm not the surgeon, so I do all the pre and post medical management. So
you really are the scum of the earth,
yes,
right?
Exactly. Yes. So, but I love my job. I love what I do. I think that, who would have thought 10 years ago when you had your surgery that there would be a specialty in obesity medicine. I've been doing this for about 20 years, and just the profound medical benefits with surgery versus the old medical management of 5 to 10% weight loss and regaining and losing, regaining and losing. So it's been very rewarding to me, but you're right. We've come a long way, but on the optimistic side, through the Obesity Society and working with ASMBS and the OAC, we're trying to get an obesity medicine specialty. And so that hopefully will come to fruition in the next couple years. So I'm very happy about that. I think we've all worked hard in trying to get some credibility to obesity medicine.
I'm very encouraged by everything that I've seen at the ASMBS, which I will be there tomorrow, and we'll be looking forward to the newest, latest, greatest innovations. But yeah, I was really kind of sad when I did find that out about the way that the bariatric surgeons were treated. So, Tracy, how are you feeling?
I feel wonderful, and I love my bariatric surgeon.
I know, isn't that great?
It's awesome, and the success has been great. I'm no longer on any medications for diabetes, cholesterol, high blood pressure, and a bonus, I've lost 55 pounds. I don't have to shop in the plus size section anymore. It was a very liberating experience going into a store and knowing, like, I can buy whatever I want in here, not just accessories.
That was awesome. My exact words when I remember the moment, the day.
Excuse me, Yvonne, we need to wrap it up. There's a live television show coming.
Okay. All right. Well, thank you so much.
Maybe we'll meet you this week at the ASMBS.
I look forward to it.
Okay.
Bye-bye.
Bye-bye.